Bismillahirrahmanirrahim. I'm going to talk about the first part of abdominal and pelvic trauma. Basically, in the first part of the abdominal and pelvic trauma, we're going to learn a little bit about anatomy of the abdomen and pelvic. So, abdomen and pelvic trauma can be divided into abdomen and also pelvic cavity. Regions of abdomen. Here we're going to see the anatomy of the flank, the anterior abdomen, the anterior abdominal area, the posterior thoracoabdominal area, anterior thoracoabdominal area, and also the back. Flank, or basically you say pinggang. So the borders or the boundaries are superior by the 6 intercostal space, inferior by the iliac crest, anterior is by anterior axillary line, and posterior is by posterior axillary line. Anterior abdomen, or the front, the stomach in front, yang color brown tu, so boundaries or borders can be superior by costal margin, inferior ada 2, inguinal ligament and also symphysis pubis, and lateral kanan dan kiri ada anterior axillary lines. Next, thoracoabdomen pula. So borders dia superior nipple line anteriorly and then posteriorly by infrascapular line. Inferior dia pula borders ada costal margin, ini yang color green ya, and organ dekat thoracoabdomen ni diaphragm, liver, spleen and also stomach. Okay, back ni include posterior thoracoabdomen, still yang color green tu. Borders dia superior, atas is the tip of scapulae, and then inferior is the iliac crest, and lateral both right and left is the posterior axillary lines. For pelvic cavity, it's actually an area surrounded by the pelvic bone, okay, in front and also back, right? Content dia you have to remember ada rectum, ada bladder, ada iliac vessels, ada basically female internal reproductive organs juga. Okay. Retroperitoneal space is actually space at the back to the peritoneal lining of the abdomen. Okay. Contents dia memang kena hafal. Abdominal aorta, inferior vena cava, duodenum, pancreas, kidneys, ureters, and colon, ascending and descending. If injury or trauma happen to this retroperitoneal space, it's very difficult for us to detect. Why? Because first, this space lies very deep within the abdomen. So when the patient comes, patient didn't complain of abdominal pain, or when you examine, there's no sign of peritonitis. The presentation or the symptom will come very much late. Okay, so you have to observe this patient, jangan terus discharge. And then, secondly, this space susah nak sample or cannot be sampled by diagnostic peritoneal lavage or DPL. And the third one, this space is poorly visualized with ultrasound. Okay, so when you do fast focus assessment sonography of trauma, you can't see free fluid in this area because basically you cannot find this retroperitoneal space area in your ultrasound.